Has your staff come back to the office yet?
Yeah, so this is a little bit unique. I don't know that I've really talked to anybody that brought them back quite as quickly as we did. So one thing about the Midwest was it took a little bit longer. We didn't see the surges the same way that everybody did in the coast. Our staff here, our IT organization, has been a top-rated employee engagement or department every time we've done our surveys since we've been here. And they enjoy each other. They work really hard. They play hard together. And because of that, they wanted to come back to the office. We brought them back around June or July last year, back into the office. And that's I think, pretty unique. I mean, there's a lot that are not back in, and we've been back in the office for over a year. Even in some cases, we had to do that smart. We had to segregate people certain ways. We had to follow protocols, but people just really wanted to be around their coworkers more so than sitting in their basement. And it's just a tremendous culture, I think, that we have here, that our employees want to do their work that way.
Yeah. Have you modified your facilities or anything at all, or just practicing good practice around there, and vaccinations have really helped to mitigate any major risk of the work environment?
Yeah, I mean, early on, we had some of the luxuries of, within Norfolk, we have two campuses right now. There were two hospitals that merged a number of years ago. So we have space that was available. So we were able to just segregate teams early on without knowing how, with exposure risk and those kinds of things. We made sure to do that so that we didn't have a point of failure where we'd have to send exposure home and all of a sudden we lost the two or three people that work on a certain technology. So we tried to separate those, and then so the social distancing within the location they were at and mask requirements. Obviously, vaccines have helped a ton as well. So it's been something, like I said, that's, I think, a little bit different than other organizations, but it really has turned out well. And we've had no significant issues. Certainly, we've had some folks that have been, before the vaccination, had actually gotten COVID, but we never had any real mass issues or any exposure issues.